All right, let's take you back to the President's address last night. President Cyril Ramaphosa raising concerns about the resurgence of COVID-19 infections. Cases are steadily rising in the Eastern Cape, with new cases in the last 14 days at about 145% higher than the previous 14 days. Now, large social gatherings, university students going back to campus, and relaxed health protocols at restaurants and shops, just some of the reasons being blamed for that spike. The Nelson Mandela Bay region is the worst affected in terms of the second wave and has placed pressure on trauma and intensive care units. Let's unpack more about what's happening in that province. We're joined now by the former clinical advisor of Health Minister Dr. Zweli Mkhize. She's now the COVID-19 project management head in the Eastern Cape. That's Dr. Sibongile Zungu. Dr. Zungu, good morning. Thanks very much for your time this morning on the AM report. Incredibly worrying, these numbers coming out of the Eastern Cape. In the last week, the number of new cases in the province, 50% higher than the week before. What's going on there?
Good morning, and good morning to your viewers. What we have seen in the Eastern Cape is that we have a real increase in the numbers of cases, but this increase seems to be confined mainly to the western part of the Eastern Cape, being the Nelson Mandela Metro and the Sarah Baartman district. Mm-hmm. In Sarah Baartman, in the first week of October, we saw an increase in the cases of COVID-19 that was due to some seasonal farm workers that had aggregated there for fruit picking, and that has never then abated since then. This was after we had seen a constant decline in the number of cases since towards the end of September and the beginning of October.
So, Dr. Zungu, from what you're saying, it sounds like, it's just as simple as what the President had to say last night. It's the fact that people are not adhering to those non-pharmaceutical interventions. People are not practicing social distancing. They're not wearing masks. They're not sanitizing often enough.
Unfortunately, that is the reality of what we are seeing. With the opening of the schools and the universities and the activities that have increased with the movement of people, especially between Sarah Baartman district and Nelson Mandela Bay Metro, that movement of people is with no prevention measures being taken, is actually increasing the risk, and that rise in the number of infections is putting a pressure on the health system in terms of the monitoring of the cases, the tracing of their contacts, and it doesn't help in the Nelson Mandela Bay Metro because we also have social ills there. We do have crime on the rise. We have had 4 incidences of hijacking, in some instances at gunpoint, of the health workers whilst they are out there monitoring cases and tracing their contacts. Last night, one of the hospitals was plunged into darkness because of the cable theft for electricity, and the hospital had to run on a generator, and it's still running on a generator since early last night, right up until now, until that cable is fixed. And therefore, this is draining resources that could have been directed to other needs in health.
Yeah, absolutely. Dr. Zungu,
yes.
let me come in there. You talked about the Nelson Mandela Bay Metro and the Sarah Baartman district being particularly hard hit by the second wave of infections in the Eastern Cape. Talk to us about your special care beds in the province, your ICU units. Are we keeping up with the people who need help for COVID-19?
We are keeping up. What we had done, because this was a sudden occurrence at the time when we were preparing for level 1 and reintroducing services. And from the time we at alert level 2, the whole province had less than 200 cases per day. And as we were doing the catch-up plans for reintroducing non-COVID health services, then we started observing the trends in October that there was an increase. At that point, we had booked cases, we had to manage slowing down the services. And then we have now looked at our capacity once more in the preparation for COVID-19 in the first wave. The province had renovated facilities. The Doranginza Hospital had a 100-bed unit that was renovated and fitted with oxygen points, and the oxygen supplies to the hospital was improved, and that has created additional capacity. The challenge has been then to gain staff, clinical staff to man the ward by closing the services. So it's a balancing act that we are working on. At this point, we have started pulling back the elective services in Livingston Hospital to gain staff to be able to man the wards in the hospital. At Livingston Hospital, at the basement, there is a unit that was prepared since 2010 for the disaster management that is available with a capacity of 70 beds that has been fitted with oxygen and equipment to assist with high flow oxygen. It has been procured. So that big hospital does have capacity. At this point, the staff is being shifted to ensure that the capacity is created. That is not sufficient. They have made a request for additional staff to be recruited, and the province is now at that point where we are just looking for additional staff.
Yeah.
Then the province also looked at Empilweni Hospital, which is a TB hospital, and that hospital, the entire hospital, has been recommissioned for COVID-19 and providing 129 beds for the Nelson Mandela Bay Metro. Yeah. Then also there is the field hospital.
Dr. Sibongile Zungu, thanks for your time this morning. Unfortunately, we are out of time, but really a crisis situation there in the Eastern Cape. Nelson Mandela Bay is leading with the number of active cases in that province, now heading towards 5,000. It's just one of the metros that are struggling with new COVID-19 infections. But state hospitals in Nelson Mandela Bay, we are now told, have run out of intensive care beds. That's as of Monday this week. And of course, that's a developing story we continue to track for you right here on the channel.